First of all, what is mental health or mental illness? Well, mental health is the way we perceive ourselves from day-to-day basis. This means mental health is a state of a person's feelings, behaves, and the way he thinks. Mental health, mental illness, and mental disorder simply means the same thing. It doesn't choose who will have this. Based on the article that I read online, 14 years of age is where half of a lifetime cases begins. It can be a very long process to treat someone who have this disorder despite the effective treatments. Mental health is a broad term for more than 200 different types of conditions. Two ways a person can have a mental disorder or mental health. It can be from mild to severe disturbances in thoughts and behaviors. People who have this disorder doesn't show any sign that they are sick, especially like confusion, agitation, or withdrawal. This can cause a person's ability to cope with everyday routines. It can be also genetic. If one or two of your family members have or had a mental illness, there's a possibility that you can have it. There are many types of mental health or mental illness. Three examples are first example is autism spectrum disorder. This can be broken down into three different types of categories. These are Asperger syndrome, atypical autism, and autistic disorder. Autism spectrum disorders are a group of developmental disabilities that can cause significant social, the communication, and behavioral challenges. A person who have this disorder handles information and or situation differently compared to others. Schizophrenia is a mental disorder involves thoughts, emotions, and behaviors that lead to false perceptions, inappropriate actions, and feelings. It is an illness that can occur in a person's life between the ages of 16 to 30, and it can both affect men and women. Up to now, it's still a mystery on the causes of schizophrenia, but doctors try to control this based on a patient's symptoms with the help of antipsychotic drugs and psychosocial therapies that can help them to cope. Doctors can diagnose you if you have this disorder based on the symptoms of delusions, hallucinations, and disorganized speech, disorganized or catatonic behavior, and emotional flatness. Lastly is anxiety disorder. Anxiety disorder, people have this response to a particular objects or situations with fear or dread. Also, it's a physical sign of anxiety or nervousness like a fast heartbeats and sweating. People who are diagnosed with anxiety disorder is when they react to situations that does not fit in that category, cannot control their responses, or their anxiety is taking over their normal function. Now, who can help you to diagnose with having a mental health or mental illness? You must be assessed by a qualified professional that is an expert in a mental health. This includes psychiatrists, psychologists, psychiatric nurses, social workers, and mental health counselors. This also includes your family doctors. Pediatricians are also qualified to diagnose someone with mental disorders like depression, anxiety disorders, or ADHD. It's totally based on a person's or a patient's symptoms of mental health. A professional who's not a psychiatrist will refer you to a psychiatrist. A psychiatrist is a medical doctor that has an advanced training in that field. Now, who have or how many people that affects or that are affected by mental health or mental illness? A statistic shows that in adults that have a mental illness, that are 20% of Americans, those who are 18 years old or older, that are diagnosed with mental disorder every year. 3% of a population has more than one type of illness at a time, and 5% have a serious mental illness. Exactly 20% of doctor appointments are related to anxiety disorders. Children and adolescents who have mental disorder is the ratio is 1 in 5 children that are affected. Exactly 12 million children at the age of 18 or below have mental disorders, and out of this, two-thirds of the children reportedly said that they do not receive the help that they need. Suicide is the third highest cause of death from the age of 15 to 24, and it's the sixth leading cause of death at the age of 5 and 15. Mental health is something more than what it seems to be. It is not something that we should ignore whether we have it or not. We might have a friend who have this disorder and not know it at all because we do, then somehow we stop being friends with them or hanging out. Having a mental health or mental illness is not something that a person can be ashamed of because it can be treated. It might be a long process, but it can help. But with the help they need, it can be done. It can also be a part of a person's life, but with the right techniques and the right coping devices, they can also live with a perfect good life in an imperfect world.